Hello, my name is Briseda Gonzalez, and I am doing my presentation on Hutchinson-Gilmore Progeria syndrome. What is Hutchinson-Gilmore Progeria syndrome? It's most commonly known as progeria, which progeria is defined as an acceleration in aging. Hutchinson-Gilmore Progeria syndrome is a fatal genetic condition that causes acceleration in aging in children. Most children don't live to be past 13 years of age. What causes progeria? Hutchinson-Gilmore progeria syndrome is caused by a mutation in the gene called LMNA. LMNA makes a protein called lamina A protein, which is the structure that holds the nucleus of cells together. The disease does not seem to be passed down. It is not a genetic disease that siblings or family members will occur. It seems to be a rare chance mutation that occurs only on one. Symptoms and characteristics. As you can tell by the picture on this side, most children are born looking relatively normal, not showing any signs of acceleration until 18 to 24 months of age. Some progeria signs include growth failure, stiffness of joints, loss of body fat, loss of hair, and heart disease. Children with progeria eventually pass away of heart disease at the age of 13 years old. These pictures are pictures of children with progeria from ages 5 to 10. Some of the symptoms are that most children with progeria have very similar appearances to each other. As you can tell, within the various of ages, they even look like they could be related to each other, even though they're not. One of the biggest advancements in progeria has been the PRF by Numbers program. The PRF by Numbers program is a data sharing database organized by researchers in hopes to share it with the public, scientists, physicians, and the media to continue spreading the word about progeria. While continuing to spreading the word about progeria, they are hoping to spark new research ideas and increase funding for progeria research. PRF by Numbers and how it works is that it collects research and demographic information that is essential for new research topics to be developed. The PRF by Numbers program has different organizations within the same program that help stabilize different areas of their research. The PRF by Numbers' main goal is to hope to identify every child living with progeria globally, so they can identify every child in hopes to give them some type of treatment or to include them in any clinical trials that they have that they hope will expand the children's lifespan. The PRF by Numbers has even created a chart, and one of their biggest successes is that they now have established and understand how many more children throughout the world have progeria. And as you can see, since they started this program, every year the number continues to increase, which continues to give them more research availability. The PRF cells and tissue banks is one of the most important programs that they do have. This is actually what discovered the point mutation. The PRF cell and tissue is essential for successful treatments to find a cure. Due to its rare genetic disorder, research has to be done globally, and a database has to be available for more funding to be given. Currently, right now, they only get about $75,000 per year to endorse progeria research. The goal of the PRF cells and tissue banks is to have more available cell samples for approved research. They hope that studying this will spark new ideas in scientists to treat children with progeria. And they also want to understand the relationship between the aging and progeria versus just regular aging. And obviously, they hope to find a cure for Progeria. Discover and finding of the PRF cell and tissue bank. Like I mentioned before, one of the biggest advancements of the cell and tissue bank is that they were responsible for pinpointing the mutated gene responsible for progeria. The LAMD is a gene that produces laminid A protein. This is a protein that holds the nucleus together. The unstableness of the laminid A appears to be leading to the acceleration of aging in children with progeria, which again only causes children to live about 13 years old. This slide illustrates skin cells in children with progeria, and as you can tell, it shows the unstableness that this lambda A mutated protein gives. A normal cell is nice and round and it holds its shape together, while the progeria cell doesn't seem to hold its shape as strongly together, which this is what is causing the acceleration. Clinical trials of lonafern is a drug that is normally given to cancer patients, but they were giving it to children for 6 years with progeria in a research trial. And after 6 years, they realized this drug was actually very successful in expanding. This is a picture of one of the oldest patients that has progeria. He actually lived to be about 26 years old. My conclusion for progeria is that progeria is a widely unknown disease. There's so many things that still continue to be unknown, and researchers are hoping to get closer. Here are some of my references: the Progeria Research.org website, and also medical journals that I found at pnas.org. Thank you so much for taking the time to listen to my presentation on Progeria. I hope that you guys enjoyed it, and I hope that you guys learned something interesting and new. Thank you so much.